the outbreak is forcing a lot of us to change the way we work, shop, and learn. The same is true for health professionals. Channel 5's Cecilia Gutierrez with a story about virtual training.
It's one of the most vital parts of a patient's recovery and discharge.
Inpatient rehab sees mostly a lot of neuro patients, cardiac patients, all these patients who go to acute care and who cannot go home without getting back to their normal self physically.
Inpatient rehabilitation.
It all is from the beginning, from when you first wake up. So some of the rehab that we have, it involves activities of daily living.
Therapists, doctors, and nurses train family members and patients on daily living exercises.
Brushing your teeth, putting on clothing, combing your hair, lower body dressing, putting on your shoes, that's part of the ADLs.
Even how to handle the patient being discharged and training on assistive devices that patient may not have been used to before.
Transferring, getting in and out of a bed, getting in and out of a chair, getting in and out of a wheelchair, transferring from one area to the next.
Usually family members would come to the hospital and be trained in person, but because of the global health crisis, health officials are getting creative.
So as a facility, currently we don't have visitors or family members able to come in through our doors. So, we kind of still need to continue our services, and we had to think of the best way to do so.
We are fully functional. We have to see our patients. All our daily operations are going on with modifications with respect to infection control.
They had to think fast, and they're doing this with technology.
Since the visitors are not allowed, family is not allowed with it, we had to get creative with how we can train them, and that's how we started using the Zoom app and virtually started training the family.
There is essentially two ways to go about doing this. One way is if the family is able to download the application in their phone or their laptop, they're able to do so. So we're able to do the training inside the patient's room with the patient, and then the family could be in their home.
If families can't download the Zoom app, there's another option.
The other option is if the families are not able to download this app into one of their own personal phones, is we have a second electronic pad that we do take to the outside of the facility where we meet with the family in a designated area, and at that time we connect those two electronic pads. So we have one in the room, one outside, and the family is able to ask questions, be part of the training.
Training the families of patients this way ensures the patient is discharged with the same at-home care instructions they would have received if hospitals allowed visitors. South Texas Health System says they will continue to work with patients and their families until the global health crisis is over to protect their patients. In McAllen, Cecilia Gutierrez, Channel 5 News at 6.